I'm your host John Harry. Dear viewers, today we are going to study one of the most important diseases of the hepatobiliary system. As you know that the liver is one of the most important organs in our body and it can be caused by many of the diseases. So today we are going to study one of the most important causes of the liver. And for this purpose, to discuss this disease, today we have invited Dr. Vivian in our studio. Dr. Vivian is an emergency doctor and she's working in Hunan Provincial People Hospital for the last many years. Good morning, Dr. Vivian.
Good morning, Harry.
How are you today?
I'm doing good, thank you.
Okay, thank you very much for your precious time to be here with us.
It's my pleasure.
Dr. Vivian, can you please tell us what we are going to study today?
Today we are going to study hepatitis.
Hepatitis, right?
Yes.
So what is hepatitis and what is hepatitis?
Well, as the name implies, hepatitis is a kind of inflammation of the liver.
Oh, so it is an inflammation or infection of the liver, right?
Yes.
So what causes hepatitis?
There are many causes for hepatitis.
Okay.
The most common causes is virus.
Virus.
Yes, there are main types of viral hepatitis, including hepatitis A, hepatitis B, C, D, and E.
Okay. So it means that there are many types of viruses which can cause hepatitis,
Yes.
right? Is there some other causes for hepatitis?
Yes, of course. There are also many other causes for hepatitis, like heavy use of alcohol and some toxin like poisonous mushroom.
Poisonous mushroom,
Yes,
right?
and some certain kind of medication like some herbal medicine. And also there are some autoimmune disorders can cause hepatitis.
Okay.
Yes.
But as you mentioned that one of the most important causes of hepatitis is infection, right?
Yes.
Viral
virus
infection. So how we can get this viral infection? Let's suppose I'm a healthy patient, right?
Yes.
And if I get hepatitis, how I can get this viral infection in my body?
Okay, for hepatitis A and hepatitis E, this virus are mainly spread by contaminated food and water. Yes, if you eat contaminated water or food, you will get hepatitis A or hepatitis E.
Okay.
And for hepatitis B and hepatitis C, this virus are mainly spread by infected blood or bodily fluid.
Okay.
And also sexual activity.
Sexual activity.
Yes,
right.
and sometimes it can also be passed from mother to child by pregnancy or childbirth.
During childbirth, right?
Yes.
As you mentioned that hepatitis A and hepatitis E are transmitted by the infected water, right?
Yes.
So I can guess that this must be very common in the developing countries, right?
Yes.
Or
yes.
underdeveloped countries.
Yes, that's true.
Okay. So once the patient gets this hepatitis, what are the signs and symptoms? I mean, how the patient know that I have the hepatitis?
Well, it depends on the stage. You know,
Stage,
yeah.
okay.
During the compensated stage, people have no obvious symptoms or signs.
Okay.
But when it develops to uncompensated stage, people will have jaundice. The yellow color of the sclera and skin.
Skin, okay.
Yes, and also they will get nausea and vomit and sometimes bad appetite, tiredness, abdominal pain, and etc.
I see. So it means that, as you mentioned, that in the hepatitis, patient get the jaundice, right?
Yes, jaundice.
So it means that when the patient has the jaundice, we must go to the hospital.
Go to hospital.
And check for hepatitis.
Yes.
Have a check for hepatitis. Okay. So once the patient gets hepatitis, how we can manage as a doctor? How we can manage or treat these kind of patients?
Okay, for patients with the hepatitis A and hepatitis E, the best treatment is good nutrition and good rest. Yes, and but for chronic hepatitis B, the best way is to control the replication of virus because it is relative to the progression of this disease. And there are many antiviral medications that you can use. It's up to physicians' options.
Okay.
Yes.
Okay, that's right. So it means that as we see that hepatitis B and C they are very common.
Yes.
So they must be treated with medicine, right?
Yes.
Otherwise they can cause the complications.
Complications.
So what are the complications of the patient who get hepatitis?
So many complications.
Okay.
When you are in ER,
Oh, yes,
you
I
can see
remember.
patients with gastrointestinal hemorrhage because of
yes.
hepatitis.
Oh.
And some patients
Oh yeah,
Yes,
hepatic encephalopathy, right?
encephalopathy. Yeah,
Oh,
yeah, that's
I
true.
see, I see.
And sometimes people get carcinoma because of hepatitis B or hepatitis C.
Oh, so it means that this disease it must be treated, right?
Yeah, must be treated.
If we put this disease untreated, it can cause some dangerous complications like cancer
Yes.
or the GIT bleeding, right?
Yes.
Okay. So how we can prevent ourselves from such kind of lethal diseases?
There are vaccines,
Okay.
yes, for hepatitis A
Okay.
and hepatitis B. And if you want to prevent yourself from hepatitis A, you should drink clean water and eat clean food. And for hepatitis B, there is vaccination, right?
Okay.
But there are also many other ways. And as ordinary people, yes, you should pay attention to do not use injection drugs.
Oh,
like
yeah,
this.
yeah.
And safe sexual activity is very important. But for doctors, you should prevent hepatitis B by wash your hands. Yeah,
I see.
hands hygiene is very important.
Hands hygiene.
Before and after contact with your patient.
Okay.
And you should pay attention to sharps and needles while you are practicing.
I see.
Right? Yes.
So as a doctor, we also must be very careful
Yes.
by managing such kind of patients, right?
Yes.
Okay, that's all right. Thank you very much, Dr. Vivian, for your explanation.
Thank you.
Okay. Dear viewers, as you have seen that Dr. Vivian has explained hepatitis in a very good detail. I hope you guys must have learned something out of it. If you have any question or suggestion, you can email us. See you next time with a new topic. Till then, take good care of yourself and your loved one. Stay tuned. Have a good day. Bye-bye.